Hello, welcome to this evening's program, COVID-19 and Your Lung Health, hosted by the Meyer Cancer Center Office of Community Outreach and Engagement. My name is Kellie Jack, and I'm the program manager for the office. We are so excited to have you join us this evening to discuss what we know about COVID-19 as related to our lung health and how we can protect our lungs during this time, in addition to wearing a mask, washing our hands frequently with soap and water, and remaining physically distant. As the nation is reaching a record number of cases per day, and New York City is seeing an increase in cases, it's important that we come together as a community to protect ourselves and our neighbors. Before we begin, I would like to remind you all to use the Q&A function for any questions throughout the evening, and we will be able to address them at the end with our live panel. We will then, I also ask that you know that your cameras will be turned off through the evening and you're unable to unmute yourself. So definitely use that Q&A function for all your questions. At the end of the evening, our speakers, again, will be on their panel, and we will announce the winners of the 3 $25 gift cards. So it's my pleasure to welcome Brooklyn native, Dr. Anthony Saleh, who's a pulmonologist and the program director of the Pulmonary Critical Care Fellowship Program at NewYork-Presbyterian-Brooklyn Methodist Hospital. He received his medical degree from St. George's University of Medicine in Grenada and completed his postgraduate training at New York Methodist Hospital. He's been here for quite some time. Thank you, Dr. Saleh, for your service to the Brooklyn community. He will now be providing an update on COVID-19 as it relates to our lung health.
Good afternoon, everybody. My name is Anthony Saleh. I am the program director of the Pulmonary Critical Care Medicine Fellowship Program here at New York-Presbyterian-Brooklyn Methodist Hospital. I will be speaking today about what do we know about COVID-19 as it relates to lung health. I don't think there's any more important topic that we could be speaking about. Here is the overview of what we're going to briefly discuss today. We will go over the scope of the pandemic. I think all of you know the absolute cataclysmic effect this virus has had on the entire world. And as you'll see soon, particularly here in New York City, we're going to spend some time going over how the lung is the predominant organ involved, while many organ systems are involved, including the kidneys, the brain, the heart. Far and away, the most common organ involved with COVID is the lung, and we'll show you both the short-term and long-term, or at least potential long-term side effects. We know a lot about the short-term effects of COVID because we've seen so many cases. We don't know a whole lot yet about the long-term effects, but the earliest cases now are about almost a year out, and we are indeed, both from those cases and some of our cases here in New York City, we have that are about 6 or 7 months out. We're starting to get a little gauge of the potential long-term pulmonary issues. So we'll go over all of these types of lung involvement. First, what we know about the short term, and then second, what we think and know a little bit about the long-term pulmonary effects. This is a devastating disease that has truly infected a plethora of people. If you look worldwide as of a few days ago, there are 41.5 million cases of COVID, of which there are 1.14 million deaths. Those are staggering numbers, really. Now, if you look in the United States, we have about 20% of the world's cases, and more ominously, about 20% of the world's deaths. So as you can see here, we have over 8.5 million cases in America, and we have almost 225,000 deaths. These are extremely sobering numbers. And to make that have more of a local flavor, here in New York City, particularly during the height of the outbreak, which was the last 2 weeks of March, the entire month of April, and probably the first 2 weeks of May, New York City has been the epicenter, the absolute center of this disease has been our hometown of New York City. Now, this is what the virus looks like microscopically. Certainly, that's something that's more for research, but let me show you a little what it looks like, certainly in the short term. So here's a patient, and you could see attached, that's an endotracheal tube, which is put in the mouth and it ends up in the trachea, or the main breathing tube. And this is attached to a ventilator. So this is a patient on a ventilator. Now, let me just give you some statistics which are really so disconcerting, but they reflect the severity of this illness. I am here in Presbyterian-Brooklyn Hospital, New York-Presbyterian-Brooklyn Methodist. So normally, during pre-COVID days, we have a big 620-bed hospital. We usually had anywhere from 25 to 30 patients who were what we call intubated and on a ventilator during the day. 25 to 30 may have been a little more, a little less. During the whole month of April, and certainly during much of May, we were averaging just at our hospital anywhere from 120 to 145 patients per day on a ventilator. And that represents a 600 to 700% increase in patients. Just these statistics are mind-boggling to show you not only the severity of disease, how sick these patients get to require a ventilator, but also to show you the volume. This was not a disease that was rare. This was not a disease that was occurring infrequently. So many people were getting this, and we were literally getting tens to hundreds of new cases a day. And that wasn't just true here at New York-Presbyterian-Brooklyn. We saw it in Queens. We saw it in, of course, the main campus. We saw it in Lawrence. We saw it at the Columbia campus. This was universal throughout the entire Presbyterian system. And of course, I can speak as to our Brooklyn experience. So many people requiring ventilatory assistance. Lots of those patients, unfortunately, died. Not all of them. We had some great outcomes, but we did have a lot of patients who died, and this was not an uncommon scenario at all during the height of the pandemic, having these mobile morgues in front of our hospitals. This was just heartbreaking for patients, for families, for healthcare workers. This truly taxed every single one of us, both physically and emotionally. But with the great support we had, our system provided so much support to all of our institutions, and the enterprise paid so much attention to both the physical and emotional well-being, both of the patients, their families, the staff. We had lots of good outcomes. Here's a patient of ours who, this gentleman was on a ventilator for almost 2 months. He had a tracheotomy done. He was extremely sick. And this is him about a month and a half ago, completely recovered, living his normal, Well Life, that's his daughter, who also happens to be a nurse at our institution. So while much of it was gloom and there was a lot of doom, fortunately, this was not an uncommon outcome at all. We had a lot of very good outcomes at all, which certainly we're very thankful for. So the short-term pulmonary effects, as I went over in some detail, many of these patients required a ventilator. They had severe respiratory failure, and interestingly, even the ones who didn't require a ventilator, if they had pneumonia, many of them were this close to a ventilator where they were just teetering on the brink of so close that if anything else went wrong, they would indeed have required a ventilator. So we had lots of patients who either did indeed go on a ventilator or were perilously close to needing ventilatory assistance. A lot of that was from pneumonia, but many of you may know blood clots, both big and micro thrombi, as they're called, played a role. And unfortunately, a good number of these patients did indeed pass away. I'm going to show you some images that we have. I think these are interesting just to show you. This is an image that maybe 8 months ago, pre-COVID, may not have meant much. This might have been someone who had an atypical pneumonia where they weren't sick. And here you could see this is normal lung, and this haziness, this sort of whitish area, this is a very early COVID pneumonia. Then many of them progressed. You could see here, this is a little more involved, a little more extensive involvement of the lungs. And here's someone who's actually gotten worse. And you can see, and you don't have to be a medical person to see, this is much more involved. This is much hazier. And the sicker, and these people, the more involvement in their lungs, the sicker indeed they were. Now, the short-term effects we went over and were so many times life-threatening. Now, long-term pulmonary effects, we don't have a whole lot of data because the virus has not even been out for a year. So we are starting to very slowly get some studies from here, from China, from Italy, and other areas of Europe. We're starting to see now where, while it's very early and we need much more data to more definitively say this, we're seeing that even after they're improved, after they're freed from the ventilator, after they have been, after they're not on oxygen anymore, so now they're stable or much more stable, many of these patients are getting a troublesome cough. Some of them still are short of breath. And the two most worrisome down the line aspects of this disease, which we don't know certainly by any means yet, is will they develop fibrosis, which is severe scarring of the lungs, and will some of them go on to develop lung cancer? And there's a connection there because some people who have scarring of the lung, that scarring becomes an area where cancer may indeed form. So long-term effects, since it's less than a year old, we need a lot more data. There are many unanswered questions, but we certainly know, at least at an early level, that some scarring is occurring. Will the scarring get worse? Will the scarring lead to lung cancer? Those are very critical questions that we hope to answer over the next 6 months to a year. Now, this is a CAT scan that shows you lung scarring. There's severe scarring here. Now, the common condition that causes this is called idiopathic pulmonary fibrosis, which is lung scarring. However, this CAT scan, while it looks exactly like an idiopathic pulmonary fibrosis CAT scan, is actually a CAT scan of a patient who had COVID, severe COVID, and went on to develop this lung scarring. And what we suspect is that those patients who develop that degree of scarring may not get their normal lung function back, may be permanently disabled or at least somewhat disabled. And again, if they keep the scarring, and that type of scarring typically does not improve, they may go on to develop lung cancer. Again, certainly entities we will be thinking about in the future. So to summarize, COVID-19 is a devastating, catastrophic illness with many lung manifestations. We certainly now in the acute phase have treatments for the early phase, for the acute severe disease. We know when they come in, there are certain markers that we gauge and we monitor, and we definitely have some treatment, whereas in the middle of March, we had no treatment. So that's very positive. And in terms of long-term, although it's too early to tell, there certainly appears to be major potential for long-term side effects. And this will be a very important topic to follow as we go down the road. So I'd like to thank you for your time and attention and appreciate your listening to this. Thank you.
Thank you so much, Dr. Saleh, for that wonderful presentation. I think you really drive home the importance of remaining socially distant and making sure that if you can just avoid getting COVID, to do that, since we don't know exactly what the long-term effects are of this virus. So everyone stay healthy, wear your mask, and make sure to wash your hands with soap and water. Next, we have the pleasure of hearing the next presentation from Dr. Sanso, who graduated from NYU School of Medicine and went on to complete her training in internal medicine, as well as pulmonary and critical care medicine at NewYork-Presbyterian-Weill Cornell. She is now a pulmonologist and intensivist at NewYork-Presbyterian-Queens and the director of the internal medicine training program. Dr. Sanso will be speaking with us about lung health in the era of COVID-19. Thank you.
Hello, everyone. I'm very pleased to have been invited here to talk to you about lung health in the era of COVID-19, which I know is a really important topic at the moment and a popular one. It's really difficult when we continue to see pictures like this one cropping up on all of our news sources with maps of COVID spreading across the world. It's really easy to feel out of control of our own health. There's clearly a lot of factors that we can't control individually, but there's also many things that you can do to reduce your risk of respiratory infections and to improve your overall lung health to decrease the risk of complications if you do so happen to become infected. And so that's really what we're going to focus on today. So you're probably tired of seeing this, but the most effective way to protect yourself is by wearing a face covering in public and maintaining a safe distance from others. This is not just true for coronavirus, but it's true for all of the other respiratory viruses that come back every year around this time when the weather starts to get cold. And these ones can really cause severe disease as well, such as influenza and parainfluenza. This is just common sense. Viruses are carried in respiratory droplets. They get into your body by getting into your nose and mouth. And if you can keep other people's viruses out of your nose and mouth, then you have no risk of catching them. Along the same lines, viruses tend to get carried to your nose and mouth on your most dangerous body part, which is your hands. Your hands are touching 1,000 surfaces a day. They're touching handrails, doorknobs, elevator buttons, subway poles, all of which could have been contaminated by someone else's respiratory droplets full of virus. So washing your hands just with regular soap and water for 20 seconds will kill these viruses. And so you should wash your hands often, but most definitely before you touch your eyes, nose, or mouth. I think most of us know by now that cigarette smoke is also a dangerous pollutant and can cause a lot of damage in your lungs. It can cause airway irritation, chronic lung diseases like bronchitis or emphysema, but it also makes you susceptible to catching other respiratory infections like pneumonias caused by viruses or bacteria. And the thing you may not think much about is that secondhand smoke can actually be just as dangerous. So even if you're not a smoker yourself, your lungs really can be affected by others around you. It's very easy for me to say, quit smoking. It's much harder to actually do. On average, it takes a smoker about 10 tries before they're able to quit successfully. So even if you've tried and not succeeded in the past, that really shouldn't stop you from trying again. One of these attempts is going to be the one that works. One of my favorite resources for smoking cessation in New York is this hotline, 866 New York Quits. They will actually connect you with a quit coach who can talk to you about how to go about trying to quit smoking. They'll even send you free materials and a starter pack of nicotine replacement at no cost to help you get started. This hotline is available in English as well as in Spanish, and all of those same resources are also available on the New York City Help Me Quit app. So if these could be helpful to you or could be helpful to a loved one, this is probably the best thing that you could do for your lungs. Outdoor air pollution is something that gets a lot of time in the news as well, and something that we know is a real threat. But this is really a bigger topic, and I really wanted to focus on things that you could do today to improve your lung health. So I wanted to bring your attention to indoor air quality. So the quality of the air inside your home, not just outside, is also really important and can impact your lungs in really big ways. So things like wood and coal smoke indoors without having proper ventilation actually reduce your lung function, and they can cause flare-ups of things like asthma and COPD if you already happen to have a chronic lung disease. Chemicals like found in paints, especially oil paints, stains, and a lot of cleaning products can also really irritate your respiratory tract. So you have to really take note of these things and make sure that the ventilation in your home, any fans, windows, and doors are open and in use when you're using any of them. The other thing to be on the lookout for is organisms such as mold and bacteria. These can really thrive in any areas that tend to be damp or anywhere that's had water damage in the past. Leaks from another apartment, leaks in your basement are big problems when you are worried about things like mold. You can often see these growing on the wall like black mold, and some of these may be invisible as well. So it's something to keep in mind if you've known you'd had a leak somewhere in your home. If you do see them, you should address them as soon as possible with your landlord or with a contractor if it's within your own home. Allergens are another thing we tend to make light of. Things like mites, dander, feathers, and pollens inside can also cause sensitivity reactions. They can cause allergy symptoms, cough, and even different chronic lung diseases. So if you're prone to any of these, it's important to keep things like rugs and curtains and other soft furnishings to a minimum, and to be sure to wash out all linens really frequently to get rid of allergens that may be there. There's indoor air filters that can also help reduce these, but they're not as effective as just trying to minimize the soft surfaces for them to live on in your home. One other toxin I wanted to mention that we often don't think about is radon. Radon is actually the second leading cause of lung cancer after cigarette smoke. We're pretty lucky in New York City in that very few residences actually have high levels of radon that are thought to be dangerous. It's something around 4 to 5%, but 4 to 5% may actually be significant. Landlords in the city are actually required to share with you the results of any radon testing if it's already been done, but they are not required to do that testing. So it's something that you could do yourself or request, or if you have your own home, it's something that should be done. It's recommended by the Department of Health every 5 years. Usually it's done on basements and first floors because higher floors tend to not be affected. So if you have a basement or you live on a first floor, something to think about. Radon testing is fairly inexpensive. It can actually be ordered from the State Department for between $10 and $25 to get the charcoal cans. So it's low risk in this part of the city, but it's also a pretty easy thing to look for and something to consider. So we've been promised a vaccine for coronavirus, but we do not have access to that yet. But we do have a lot of other vaccines that can help protect your lungs, and these have been around for decades and they've been proven to be safe and effective. So they're not just for kids, adults really do need vaccines too. It's recommended that all adults receive a yearly influenza vaccine to help protect yourself. It's also recommended that all adults over the age of 65 have a vaccine against pneumococcal pneumonia. Pneumococcal pneumonia is one of the most common bacteria that cause pneumonia, and it can be life-threatening. In addition to adults over 65, adults who have chronic medical conditions, and this can be anything from chronic lung disease, kidney disease, anything that impairs your immune system. Actually, being an active smoker counts as a chronic disease. All of these people also will qualify to get the pneumococcal vaccine before the age of 65. These are really, really important this year because catching any of these other illnesses will actually put your lungs at higher risk for catching another lung infection, including coronavirus. So if you're not sure whether you would qualify for these, talk to your primary care physician. If you haven't gotten your influenza vaccine yet, please do. We're already seeing a number of influenza cases cropping up a little bit earlier than usual this year, and so it's going to become a real problem very soon. Another thing to consider is your physical activity. When you're physically active, your heart and your lungs have to work harder to supply additional oxygen to the rest of your body. So in the same way that regular exercise makes your muscles stronger, it also will make your heart and lungs a lot stronger. And as your physical fitness improves, your body becomes more efficient at getting oxygen into your bloodstream and transporting it to all of the muscles that are working so hard. And also it will improve your total lung capacity over time. This is one of the reasons why you're likely to become less short of breath during exercise over time as you continue to practice those muscles. It's also been shown that when you exercise, your body actually creates natural antioxidants that get produced, and these will go into your lungs to protect them against lung damage, such as that caused by COVID-19. And this is actually something that's being researched. People who have higher levels of physical fitness are at lower risk for having complications for this disease. So the CDC recommends that all adults get at least 30 minutes of moderate physical activity 5 days a week. And that sounds like a lot, but we're not talking about a formal exercise program in order for it to be beneficial. So examples of moderate activity could be just 30 minutes of brisk walking, recreational bicycling, gardening outside, even vigorous house cleaning helps. And a lot of us are doing that already. I know that being inside for quarantine reasons and also because of the weather could potentially be putting a damper on a lot of people's exercise classes that they're previously used to going to. There's actually some great resources from the National Institutes of Health for indoor exercises. They have a series of workout videos you can just find on YouTube under NIH Go for Life. Some of these are geared towards older adults or people with some physical limitations to be able to provide a modified exercise, but they have a whole variety of things that you can do indoors with not really any more equipment than yourself, maybe a chair for some of them. And so it's something that everyone can have access to, even when you're not able to get outside or you're not able to get to the gym. And finally, something that I think has been underappreciated in terms of how important it is for our lungs, which is your diet and nutrition. But it's becoming increasingly recognized as a modifiable contributor to your lung disease. There's more and more evidence coming out that your dietary intake has a lot of influence in the development of things like chronic obstructive lung disease and asthma, both early in your life, but also later on and in disease development. It's also been proven that certain diets can actually increase or decrease inflammation in your lungs. And inflammation is really the important factor in terms of causing lung damage. So there's a lot of studies showing that if you eat a diet that's rich in minimally processed plant food, specifically fruits and vegetables, as well as bread, cereals, beans, nuts, and seeds, and kind of limit your intake of things like fish, poultry, and red meat as little as possible, those things can decrease your risk of respiratory disease. And the other component to this is antioxidants in your diet. I'm sure we've all heard about antioxidants and antioxidant-rich foods, even things labeled as superfoods in the supermarket. What this really talks about is the generation of what's called oxidative stress. It's a type of inflammation in your lungs that can be triggered by things like air pollution, airborne irritants, just regular inflammatory cells in your lungs and their normal reaction to having things like viruses and bacteria in there. they generate this oxidative stress, and that's what really causes the lung damage. So foods that have antioxidants that are natural, like vitamin C, vitamin E, and carotene, these are abundantly present in fruits and vegetables. These can actually help minimize the risk of you having those type of damage to your lungs from oxidative stress. Antioxidants are also found in some places you may not think about, like nuts, vegetable oils, cocoa, green tea, and even red wine. So it doesn't mean that just because you're following a good, nutritious diet doesn't mean you can't enjoy something every once in a while. So overall, there's a lot of factors that you yourself can take control of to modify to improve your own lung health. Recognizing that some things that are happening obviously are outside what you're able to control. It is within your control to put yourself in the best possible position. Should you become, hopefully not, should you become infected with any respiratory virus this season, whether that be coronavirus or any of the standard viruses that we generally see. So everyone be safe and stay healthy.
Thank you so much for that wonderful presentation, Dr. Sanso. So I know that in addition to washing my hands with soap and water, in addition to wearing my mask and staying physically distant, I have to also think about a healthy diet, making sure that I'm exercising, getting those vaccines, and as well as looking for allergens within my home. Dr. Sanso also spoke about the importance of smoking cessation. And tomorrow we'll go a little bit more in depth about that and what that looks like for people. And also it's important to remember you yourself may not be a smoker, but being around smokers also impacts your lung health. We're next going to be joined by Dr. Chiti Parikh, who's the Executive Director of Integrative Health and Wellbeing at New York Presbyterian Hospital in collaboration with Weill Cornell Medicine. She is a board certified in internal medicine and integrative medicine with additional training in functional medicine, medical acupuncture, and Ayurveda. In order to provide the highest level of compassionate and individualized care, Dr. Parikh combines cutting-edge Western medicine approach with ancient wisdom of Eastern traditions into a truly holistic approach to patient care. She has co-founded the Integrative Health and Wellbeing Program, which offers integrative modalities, such as acupuncture, meditation, yoga, nutrition, and psychotherapy. Thank you so much, Dr. Parikh, and she will now be speaking about alternative therapies for optimizing your lung health.
Good evening, everyone. Thank you so much for taking the time to join us for this very important topic. I'm Dr. Parikh. I would love to talk today about integrative therapies for optimizing your lung health. So a lot of times, the word integrative, alternative, or complementary medicine comes into play. So just want to highlight the difference between integrative medicine and what conventional medicine is. Integrative medicine really looks at the whole person. So as Hippocrates said, it's more important to know what sort of a person has a disease than to know what sort of disease a person has. Because we know that health is really a state of complete mental, social, physical well-being, not just absence of disease, right? So when we talk about an integrative approach, it really takes into account the mind, body, and spirit aspect of health and healing. So we are going to talk about some of those domains and how they can play a role in your lung health. So there's three main strategies that we'll review quickly today. These are key strategies for, I would say, for majority of diseases we encounter, but holds particularly true for lung health. So first and foremost, food is medicine, right? So reducing inflammation through diet is extremely important, especially when we talk about lung health and COVID, because we know COVID causes a lot of its sort of damaging effect on the body by increasing inflammation. So if we can reduce inflammation in our body through food, then that's going to be our number one step and number one ally in this fight against COVID. So, and a lot of the risk factors for COVID tend to be sort of the high inflammatory state diseases, such as obesity, diabetes. So by using our food as a way to combat inflammation is really a key strategy. The second is optimizing your immune system. We know that the stronger the immune system, the stronger we are at withstanding the effects of infections. And we know the role that stress plays and sleep plays in optimizing our immune system. And last but not least, we always want to talk about strengthening our lung capacity. And we can do that through various different types of exercise, depending on your level of comfort and how, what kind of exercise that fits you best. And there's many options. So we'll review today all of these key strategies. So food as medicine, right? So when we talk about a diet that is really helpful for lung health, for COVID, is really focusing on the anti-inflammatory quality of our diet. And we've all grown up learning about, eat your vegetables. And again, that holds true. And what research studies have shown is at least 5 to 7 servings of vegetables and 2 to 3 servings of fruits are considered to be the cornerstone of anti-inflammatory diet. And why is that? Because we know that vegetables and fruits have a very high amount of anti-inflammatory molecules, such as something called flavonoids, but also many other vitamins and nutrients that are key in fighting off inflammation. And some of those molecules are one of them is called quercetin, that is often found to be very useful in allergies or allergic type of inflammation. And foods that are high in quercetin are things like onions and apples. Another molecule called myricetin is really high in things like oranges, tomatoes, nuts, and berries. Many other molecules, apicinin is really high in parsley, celery, chamomile. Again, these things, these herbs and foods have been used as medicine for hundreds, if not thousands of years across the world. Curcumin is a good example, which is what you find in turmeric. The turmeric is something that's very commonly used in Asian cuisine, and we know it has significant anti-inflammatory property. Green tea, so EGCG is a molecule that comes from green tea that is also one of the flavonoids that helps fight inflammation. And I'm sure you've heard a lot of information about things like vitamin C and zinc and vitamin D to be very helpful in fighting infections such as COVID. So again, what it comes down to is the way these things help you fight off any disease, especially COVID, is by reducing inflammation in your body. So I really encourage you to think about food as medicine as the #1 key strategy, and they'll help you not just with COVID, but many other conditions. Immune system, optimizing your immune system. Sleep is so important. And research studies have now shown that in one study, they found that some people who slept for less than 5 hours for over 7 days had significantly increased risk of developing rhinovirus, which is what causes common cold, by 350% compared to individuals who got at least 7 hours of sleep. Stress, we know stress suppresses your immune system. Anytime we're really stressed, we know we get sick very easily during those times. And integrated modalities such as meditation, breathing exercises that are based in yoga can significantly increase, reduce stress, but also affect even blood tests. So there's a blood marker called CRP that we often measure, especially in COVID patients. We use that blood test a lot to measure the level of inflammation in the body. And studies have shown things like meditation and yoga can help you reduce those levels of inflammation. And last but not least, strengthening your lung capacity, right? The stronger the lungs, the better off you are when it comes to resisting the damaging effects of COVID-19. And one of the ways you can strengthen your lung capacity is through cardiovascular exercise. So whether it's things like running or swimming, basically cardiovascular exercise is something that's going to get your heart rate up. Right? So it could be running, it could be brisk walking, it could be high intensity workouts, but we know that that can be challenging for a lot of people, especially right now when people don't necessarily have access to gyms or running outside as it gets colder. There are other options. So things like yoga. People often think that yoga is something, like headstands and bending backwards in weird pretzel-shaped forms, but yoga is far more than that. So the most fundamental basis of yoga is actually connected with the breathing. So breathing is 90% of yoga, not necessarily all these awkward poses. So yoga can be done by anyone. If you're breathing, you can do yoga. So you can do chair yoga, you can do bed, resting in bed yoga, right? Just focusing on your breath. And Tai Chi is another option. So Tai Chi is a movement-based therapy. It's very gentle, thoughtful movements that really help you focus again on your breath and synchronizing breath with movement. So these are very good options for everyone that you can do even in your home, right? There's so many videos on our website at Integrative Health and NYP. We have simple, easy to follow yoga videos, meditation videos that you can use every day. And one thing I would say is stress is a big issue, right? So we're all experiencing a high amount of stress right now, right? Especially over the last few months. And that what that does, it puts us in this fight and flight, right? So being in fight and flight is not good for our body. It's good for a short period of time because it helps you fight and flight. But if we're in fight and flight for months and, for a really long time, it can do a lot of damage because it increases the stress hormone called cortisol. So we know that our body, every single organ acts very differently when we're stressed and we're in the fight and flight mode, right? So the key is getting our body more relaxed by getting ourselves out of fight and flight. And one of the main things that I often recommend, I'm a big believer in meditation and yoga. The reason is meditation, yoga, even things like Tai Chi, exercise, a lot of these things work on our body by reducing the fight and flight response, by reducing inflammation, by reducing cortisol. They do it by activating something called the vagus nerve. The vagus nerve is extremely important in our body because it can help control our blood pressure, our heart rate, our breathing capacity, digestion, hormones, and the list goes on. So the vagus nerve is sort of the king of all the nerves in the body. And that's sort of the key to our mind-body connection. And you can see the Western medicine looks at vagus nerve as a nerve that connects the mind and the body and sends nerve signals throughout the body. In Eastern medicine, I'm sure you've seen a picture of someone sitting in this posture with chakras, right? Chakras are an Eastern medicine way of saying that's where the vagus nerve is and that's where we're activating. So in yoga, people might say you're opening your heart chakra. In Western medicine, we say you're activating your vagus nerve at the level of your heart, right? So many different ways to say the same thing. Ultimately, it comes down to getting your body out of that fight and flight, reducing stress level, and by optimizing the vagus nerve. And there are many different ways to do vagus nerve activation, get your body out of fight and flight. And one of the easiest, best ways that we can all do is through breathing. And this is something I highly recommend that all of us practice every single day, something called deep breathing or diaphragmatic breathing. It's very simple. So this is something called square breathing technique, which I find to be very easy to follow. Basically, the key is you breathe in for 4 seconds, you hold your breath for 4 seconds, you breathe out for 4 seconds, and then you hold your breath again for 4 seconds. It's just following the square, switching every 4 seconds. Very simple technique. I really encourage you to do this every day, 5-10 minutes, whatever you can. What that does is immediately gets your body out of fight and flight, reduces your stress hormone levels, the cortisol levels, which helps you reduce inflammation in the body. So this is a very easy technique we can do that really, addresses the 2 key things we talked about, reducing inflammation and boosting your immune system simply by breathing in a certain way. So I highly encourage you to practice diaphragmatic breathing. There are many other ways to de-stress as well, to activate the vagus nerve. Things like expressing gratitude, praying, listening to music, being in nature, exposing to sunlight to get the vitamin D, laughter, spending time with pets and loved ones. These are all techniques to activate the vagus nerve, to reduce the stress level, to boost your immune system. There's research behind all of these. So pick things that you love to do and make yourself a prescription, a treatment plan, or an action plan of how you're going to battle stress. How are you going to boost your immune system? Obviously diet is fundamental, but adding some of these techniques to your daily routine can make a tremendous difference. So that's all I have for today. So again, I'll end with this quote. To ensure good health, eat lightly, breathe deeply, live moderately, cultivate cheerfulness, and maintain an interest in life. These are some wise words that I'll leave you with. But again, don't forget to breathe and breathe deeply. Thank you so much for your time.
Thank you so much for that, Dr. Parikh, and thank you all to the panelists for your insightful conversations and presentations. I kind of mistakenly put my question into the chat box for all the attendees. And so I was asking if Dr. Parikh, I think she brought up a really good point about just de-stressing using a breath technique. So I was asking if you don't mind just taking us together through a quick inhale, exhale, in the spirit of this event, which is take a deep breath.
Absolutely. So the first thing I always like to highlight when we're practicing any type of breathing exercises, it's important to sit up straight to make sure you're able to expand your lungs to their full capacity. So always, sit in a comfortable position with your spine straight, feet grounded. And then the next thing is I invite you to draw your attention towards your belly button. So we'll be practicing the square breathing. So in order to do square breathing or diaphragmatic breathing, what we really have to do is activate our diaphragm, which is the breathing muscle between the lungs and the belly. So it's very important that we use our belly muscles to breathe in and out to make sure we're getting full inhalation and full exhalations. So why don't we start? So close your eyes and draw your attention towards your belly button. And on a count of 4, we'll start inhaling very softly through your nose. So breathe in, 1, 2, 3, 4. Hold your breath for 1, 2, 3, 4. Breathe out gently through your nose. 1, 2, 3, 4. Hold your breath for 1, 2, 3, 4. Let's breathe in again. 1, 2, 3, 4. Hold your breath. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4. Hold your breath. 1, 2, 3, 4. So as you do this, you'll get a hang of it. And I know sometimes it's harder to hold your breath. It's harder to breathe in. But the point of this exercise is to really observe your breath and get familiar with it. And with practice, lung muscles, the diaphragm, our muscles, just like our biceps and our leg muscles, right? The more we use, the more we practice deep breathing, the stronger they will get.
Great, thank you so much for that. And I know that I feel a little bit better and a little less stressed, so I hope you all do too, that you were able to join in on that quick inhale, exhale, deep breathing exercise. So we have some questions coming in. And you all, I encourage you to continue to post your questions either in the chat to the panelists or using the Q&A function. So I think the first question we have here is, will there be a study in the near future for patients who have recovered from COVID but suffered from some lung scarring?
Hi, so I guess I'll take that. That is a great question. There already are a bunch of studies that have been published from China because they had the initial cases in early December 2019. So yes, there are some of those cases that are showing a small amount, and in some instances, a not so small amount of lung scarring. We are here at NYP, the enterprise, also looking at these patients longitudinally and seeing if indeed they develop scarring. So the short answer, some studies have indeed been done, but many more will be forthcoming. Thank you.
Thank you. And Dr. Saleh, as a follow-up to that question, are we seeing any lung scarring in asymptomatic individuals?
Great question. Wow. So as you know, many of you, COVID-19 can be seen in asymptomatic patients. Patients have no symptoms, they're swab positive. In terms of lung scarring in asymptomatic patients, we really have not seen that. In other words, usually they'll have known they had pneumonia and sought some attention. Now, theoretically, it's possible that maybe they didn't know they had it and they'll come down with scarring later. But usually we can do antibody tests and maybe some other tests to figure out what it's from. But in general, if they've developed scarring, they usually, at least initially, had some symptoms.
Okay, thank you for that. I think another great question related back to more so exercising that someone asked is, what if you get out of breath very easily? And I believe this may have been around the time of Dr. Sanso's talk. So if you could take that question.
Yeah, that's a great question. I think that's a problem for a lot of our patients, especially if you're not used to exercise, and getting started is the hardest part. The good news is, just like any other muscle in your body, your heart and your diaphragm and your breathing muscles all respond really well to exercise. So all you do is the best that you can. And every day you're able to do a little bit more and a little bit more. And then over time, you will find yourself getting less and less short of breath. So exercise for all of us, what it means might be a little bit different. And for you, that exercise might be just a nice gentle walk, up and down the block to the mailbox, up and down a hallway. And that's totally fine if that's what you're able to do and that's what your body can do. And that's your limit right now. That's what you should be doing. And over time, that limit will extend and extend until you're able to do more and more over time.
Thank you. And did you all have anything to add to that point, Dr. Saleh and Dr. Parikh? Okay. And someone asked, Dr. Parikh, just going back to our lung breathing or breathing exercises, in yoga to improve the lung functions. You mentioned that there are some resources on NYP's website, and someone would like to know about that. Could you post that in the chat?
Yeah, so I'll post a link to the audios and videos that we have for different types of yoga exercises and also meditation.
Okay, great. Thank you. And I just want to say that's also free to anyone outside of, you don't have to be a patient of NYP to access that. Another question that we have, someone asked that, or mentioned that they have severe emphysema. Is it possible to have had the virus and not know it? And I don't know who wants to take that question.
So I guess I'll take that. Severe emphysema, of course, would be a risk for developing some of the bad outcomes related to COVID-19. Now, in general, what I would suggest is if you have no symptoms other than your normal emphysema, then I wouldn't expect you to have it. It'd be remotely possible for an emphysema patient to be asymptomatic and get it. However, if there were any change in your symptoms, low-grade fever, a little more shorter breath than usual, just not feeling well, then I would strongly recommend to see your physician and consider getting tested.
Great, thank you. And I think that that's very important to highlight. It's just that, during this time, a lot of people are scared about going back into the doctor's office, but you don't want to fall behind on your routine screenings, on those symptoms that may be, you're not too sure about. So you definitely do want to make sure that you are keeping in contact with your primary care physician, or if you're under the care of a specialist, and making sure that you're staying up to date on all of your routine visits. Another question that we have is related to another risk factor of COVID. Does having skin cancer, a history of skin cancer, is that a risk factor for COVID? Does anyone want to take that one?
I guess I'll take it.
Maybe in general, just cancers in general, maybe?
Yeah, good. So I don't think there's been a great association with skin cancer and the development of COVID. However, as you so rightly said, Kelly, anyone who has cancer, depending on the type, usually a lung cancer, a colon cancer, a deep organ cancer would probably put them more at risk. However, some skin cancers like melanomas, these patients' immune systems may be compromised, particularly if they're getting chemotherapy. So again, while an isolated skin cancer, localized, may not put you at higher risk, every case is different, and you should certainly speak to your primary care physician and see if they have that concern.
Yes, thank you. Another question that we have, I think this is for Dr. Saleh as well, is just in regards to the changing of the virus. We know we're hearing that there may be different strains. Will a vaccine, or the potential of any of the vaccines, will that cover the different strains of the virus?
That's a great question. And if I knew the answer to that, I think I'd be out spending my billions somewhere. So let me get to that. Certainly, the virus, we feel, has different activity, different behavior. In April, it was the most virulent, most aggressive form of the virus we could possibly see. We are seeing, unfortunately, a slight uptick, but in general, and I'm being really generalizing, it appears that many of the patients are not as sick that we're seeing now as the ones in April. Some of that may be virus mutation. Some of that may be a whole other array of factors. But I will say for sure that if and when, and hopefully it's sooner than later, the vaccine comes, they will have, I think, taken into account, at least so far, all of the potential strains. Now, there may be strains that we see 6 months from now that weren't taken into consideration. But for now, my advice would be, if a vaccine comes, take it, and that's the safest thing for all of us right now.
Thank you. And a follow-up question came in regarding everyone taking a vaccine, and if and when it does. Well, we know it will eventually become available. We've heard some news in recent weeks, and I know that today another drug company stated that they have a possible vaccine that appears to be very effective. And someone is asking about, for patients with severe pulmonary arterial hypertension, is it recommended, or at this point, is it recommended to get the vaccine?
The short and long answer would be yes. Anybody, regardless of their medical comorbidities, I would suggest get the vaccine. In particular, someone with serious lung disease, of which pulmonary arterial hypertension is a very serious one. And we have here at Brooklyn Methodist a specialist who deals with these patients. I would absolutely recommend the vaccine.
Not the virus, but the vaccine. Yeah. And I think we also, it's important. I know that there is some questions coming in for very specific conditions. Again, it's very important to go to your doctor, to consider your whole medical history when making decisions, such as getting the vaccine as well. Although, Dr. Saleh said to get that vaccine if and when it does become available. But we definitely want to remind people to consult with their physicians.
Yes.
When it comes to very specific medical conditions. This question is for Dr. Parikh. So we have someone asking just about, with other chronic illnesses such as asthma, blood clots, Lyme disease, is there any specific exercise and dietary tips that you may recommend for people with a history of chronic diseases?
Absolutely. So the three main topics that we discussed in today's presentation were focused on reducing inflammation, boosting your immune system, and exercise. And that holds true for essentially any chronic condition. So that is the foundation for health and as treatment for any diseases we encounter nowadays. There can be customized options. Again, when it comes to diet, that can always be tweaked depending on the person's nutritional needs and also the condition that they are addressing. So an experienced dietitian or physician can walk you through those. But in general, the recommendations we discussed today regarding, eating your vegetables, fruits, including a lot of healthy fats in the form of nuts and seeds, as much plant-based diet as possible. We know there's more and more data supporting things like Mediterranean diet and more plant-based diet because they tend to be more anti-inflammatory. That can serve well for essentially any chronic condition. And things like exercise, managing your stress, help us by reducing the cortisol levels. So a lot of chronic conditions, their root cause often lies either in chronic inflammation or because of high cortisol levels caused due to stress or certain behaviors. So when we talk about these foundational, diet and lifestyle changes, they work for really any diseases we can think of. So because prevention is always better than cure, right? So if we embrace these, these foundational changes, then they'll serve us well to not only treat conditions, but also prevent others in the future.
Thank you for that. And along those lines, for some people who are currently maybe going through economic hardship and financial distress, would you say that could you recommend some base or staple items if you are on a limited budget to shop for?
Absolutely. So the idea is to get fresh fruits and vegetables as much as possible, right? So for those, I always encourage people to think about local farmers market, or you can even think about, the fruit carts are at every corner nowadays. A lot of times those are far more affordable than some of the bigger grocery stores. The other option is also when we think about healthy grains, nuts, and things like that, that are better to use on a daily basis, you're better off going to a wholesale stores like Costco or somewhere where you can get significantly discounted amount, because these things don't go bad that quickly, right? So you're better off going and buying those things when they're on sale or in wholesale, so that way you can stock up on those essentials, because the more you stock your pantry with healthy items, more you're likely to use those things. So anytime you go shopping, always plan and make sure you have a list of things that you're looking for, because anytime we don't plan, we end up buying things that are not necessarily good for us. So making sure that you always have healthy whole grains, fruits, vegetables, some nuts and seeds and things that you can stock your pantry with, the better off you are. So those are always the highlights in any grocery shopping trip I would recommend.
Great, thank you. This question is regarding just testing in general. So we have a question of just how often people should be tested for COVID, whether they're symptomatic or not. Do you want to answer that, Dr. Saleh?
I'd be happy to answer that, yes. So in general, if you don't have symptoms, you shouldn't be tested, right? Because not all, but many of the people who get the virus are symptomatic. Now, what I would say is if you're asymptomatic and don't know of any exposure, there's really no reason to be tested. Alternatively, if you're asymptomatic but have been exposed, and I mean a pretty close exposure to someone who has the virus, let's say a work colleague or someone in your house, obviously, or you have no known exposures, but you are ill and you have an illness that's not otherwise definable, yes, then I would get tested. So that's really a loaded question because, we can be overwhelmed with testing everybody. I think you have to target the people you test. Otherwise, the system will be inundated. And I think it's important to try to test those people who really need a test.
Yeah, no, I think that's a great point to highlight. Someone did ask as a follow-up question, how often should you be testing within a period of time? So if you do find that you are, you meet those categories, how often should it be done?
So in general, you get one test. The virus usually it'll last in your nasopharyngeal system anywhere from 5 days if you're mildly ill, up to months if you're severely ill. If you're severely ill, you'll know it. If you test positive once and you don't have many symptoms, you're relatively well, you're just a positive test, there's really no need to test again. The only time we recommend additional testing is if you're severely ill and we're going to do a procedure on you here in the hospital, or if you're ill, you tested negative, your symptoms have not gone away, then we may recommend. But for just someone who's had the virus once and they're not that ill, one test is usually plenty.
Thank you for that. Dr. Sanso, perhaps you could take this question related to the stigma associated with the virus. So someone asked a really great question, that there may be some stigma where people don't necessarily want to get tested or don't want to realize their symptoms. So how would you encourage people to approach that conversation? And if someone were to come into your practice and kind of be like, hey, I don't want to get tested, even though they're clearly symptomatic?
Yeah, that's a great question, and obviously very understandable. It's coming out of fear. People are nervous to get close to someone who has a virus, who might have the virus, and people are worried about what that might mean for their work, their family, their social interactions if they were to test positive. So it's a real concern, and I know people have similar concerns even about mask wearing, that if they're seen wearing a mask, people might think they are ill. I just
think she
reiterate that the priority, all of these other things you can figure out, but if you don't have your health, you don't have anything. And so the priority is keeping yourself safe and healthy. And since we first started taking care of patients with this virus in earnest in March to now, the mortality rate for patients, meaning how many people actually die from it, has gone down close to 30%. So we're getting better and better at taking care of this disease. We have more medications, more treatments available. We are doing a much better job taking care of people. And the most important thing is that all of these treatments, a lot of them either work better or we can only give to people before they're really, really sick or while they're early on in their course of illness. And so if you wait too long, by the time you're really seriously ill, we may have limited options for taking care of you. So I think it's really understandable, but you have to worry about yourself first. You might get tested, you may never have a symptom, you may have mild symptoms, but if you're one of the unlucky few that's really, really sick, our ability to take care of you and get you better is much, much better early on in the course of your illness, before you have to come to the hospital, before you need oxygen, before you were to end up in our ICU. So don't let that deter you in any way. You have to take care of yourself.
Definitely. Thank you for that answer. And I think it really drives home the importance of mask wearing. I know a couple of days ago, we did a social media challenge in the hospital to encourage people to wear masks. So maybe trying to, and this person who asked works in a senior center. So maybe finding fun ways to encourage mask wearing as well, may be an idea to destigmatize what we're dealing with. As we see, it doesn't affect just one person, although we are seeing disproportionately it's affecting Black and Latinos here, but everyone has the ability to get COVID. So it's really important that we protect ourselves. So along those lines, Dr. Sanso, you had mentioned that the mortality rate has gone down. Is there any difference in the virus than what we were seeing in March? And I don't know if you want to answer that, or Dr. Saleh, I'll leave that to you both.
From our perspective in Queens, I don't think there's a difference in the virus. I think the difference is two things. One, we understand the virus a lot better now than we did in March. We understand how it works. We have a better idea how to take care of people. And the second thing is, in New York in general, people have actually been doing a great job with their mask wearing and their hand washing and their social distancing. And that means that the numbers of really sick patients in the hospital have gone down so dramatically that we just have better capacity to take care of people. when you're stretch less than, you can do a much better job. And so we're improving our own ability to take care of people. So as good as the medications are, and as much improvement we've made in our ability to manage the complications of this virus, if the numbers get much worse again, then we're going to be in a very similar situation that we were in March. And so it's really, really, really important to focus on prevention first. In the event that it doesn't work, we'll take care of you. But the most important thing is to prevent yourself and large numbers of people from getting it in the first place.
Yes, that's a very important point. I think we forget that hospitals are not unlimited resources. So once they reach their capacity, and the people who are trained to deal with this virus and other illnesses, because as we see, other illnesses don't stop during this time, we have to really look out for not just for ourselves, for our neighbors and our fellow healthcare workers, because they were put through the ringer in March. So let's not go back to that. So going back to the COVID vaccine, or what is being talked about in just COVID testing, someone asked, is it possible that one can test negative for COVID at any time, but test positive for antibodies? Dr. Saleh, would you like to take that question?
Sure, thank you. Yes, that's a great question and very common. So the swab, which is the best way to make the diagnosis, the nasal swab, which is an extremely uncomfortable test where they basically take a Q-tip swab and it goes what appears to be up to your brain. It really goes way up high, but that's the right way to do it. So that test will only be positive usually maybe a few days before you have symptoms, and maybe if you're not severely ill, about a week of symptoms. After that, your swab may well be negative. Now, your antibody test, which is a blood test, that will not show that you're necessarily acutely infected. That will show that you were exposed to the virus maybe as soon as 2 to 3 weeks ago. How long that lasts, we don't know. We think it may be 6 months to 2 years, and I don't think any of us have a great idea. So you can have a negative swab and have had no symptoms, but then have had the virus, and then maybe a month, 2, 3 months later, have a positive antibody titer, which shows you were exposed. So that's actually a very common scenario, that you may have had minimal symptoms, had a negative swab, but your antibody is positive. So yes, that can happen, and it actually happens pretty frequently, especially to many of us healthcare workers.
Yeah. And I did see something where someone tested positive in one nostril and not another. Have you seen anything like that?
I have not seen anything like that and have absolutely no answer for that.
Okay.
I would say there are false positives and false negatives. So it sounds like one of them may have been a false positive or the other one a false negative. I would look at symptoms and things like that.
Perfect, thank you. And then there was another question that we had here for you, of kind of just discussing what is the major difference between the flu vaccine and COVID vaccine, and how safe is it to take one without another based on what we know right now?
So I wish I could definitively answer that question. I really can't. But what I can say is that the flu vaccine has been around for years and years and years. So obviously we're more comfortable with the flu vaccine, and the influenza vaccine clearly is very beneficial. We don't know about the COVID vaccine, and over the past week, we've been inundated with what appears to be very promising data, both from Pfizer and Moderna, and I'm sure there's going to be more of these studies coming through. Right now, I would say We don't know anywhere near as much about the COVID vaccine as we do about the flu vaccine. But being that COVID is such a devastating, potentially devastating and catastrophic illness, I would say if the safety data is good, and it appears in both these studies that it's very good, I would say it's of paramount importance, particularly given the scope of this pandemic, that you should indeed take the COVID vaccine as well.
Thank you so much for that. We have 3 last questions and then we'll wrap up for this evening. We'll stick with Dr. Saleh for this one. I think that this is a concern for many people. You may be put on the ventilator and you may survive, thankfully, but what is the quality of life for people who come off that ventilator? What have you seen so far?
That's a great question. So I'll say that those who have survived and have lived, a good number of them have really fully improved. I think it's getting off the ventilator that has proven to be very tricky for many of these patients. Now, I can't say that everyone who gets off a ventilator has a great quality of life. There are some who may end up with some respiratory impairment. But so far, what I would say is that unlike COPD, emphysema, or maybe some other conditions, this is typically sort of a hit or miss. So if they're fortunate enough to come off the ventilator, in a good number of instances, a fair number of these patients have gone on, and if not back to normal in a month or even 2, over time can get back to normal. And the patient that I showed in our presentation had been on a ventilator for 2 months, and it took him about another 2 months to get better. But now his quality of life is the same as it was before COVID. And that's the kind of outcome that we're all desperately wanting to have.
Thank you for that. Dr. Parikh, could you discuss about how acupuncture may be used in treating pulmonary illnesses or pulmonary infections?
Definitely. So when we talk about acupuncture, we're only talking about a small part of Chinese medicine. So Chinese medicine is a full system medicine that includes acupuncture, but also other modalities, including herbs. So when you talk about treating lung conditions, especially acutely or chronically, it involves acupuncture and some of the traditional Chinese medicine in the form of herbs. And even Tai Chi is a form of therapy that is often prescribed. So acutely and chronically, these things are treated very differently. And especially something like COVID, when you're acutely infected, that is not the time to go to your acupuncturist, right? So acupuncture really helps with more prevention and for chronic conditions rather than just acute conditions. And there are some studies coming out of China that looked at using things like herbal medicines and even acupuncture in the hospital setting when people were combating COVID type of illness. So there is some data there, but when we talk about how acupuncture is really used for lung conditions, it is helpful in more chronic lung conditions. Again, because it works on the same concepts of reducing inflammation. So any condition that has inflammation as a root cause, that's where acupuncture can be very helpful. But for chronic conditions, acupuncture also needs to be a long-term treatment. Something that's been going on for 10 years, something like asthma or COPD, cannot be fixed by a month of acupuncture. In those conditions, it becomes more of a supportive treatment, and it works really well in conjunction with other medications and other treatments you could be doing. So acupuncture is a good adjunct therapy, especially for chronic conditions, that again needs to be done on a long-term basis to see its full spectrum of effect.
Thank you. And integrative medicine here does offer that service as well, correct? And I think that a lot of people don't know that insurance companies, not all, but there are a good number of insurance companies that do cover acupuncture. So if you haven't looked into that, definitely take advantage of those sessions. And our last question for the evening, and we may answer a couple more questions in the chat, is regarding pregnant women during this time who may be already struggling with breathing issues. Just any advice in terms of how to protect your lung health in terms of exercising during this time, but doing it safely. And I'll give this question to Dr. Sanso, as well as if there is a quote unquote proper mask to wear during this time.
Yeah, so I think the party line on exercise when you are pregnant is that you should be able to, or at least it's safe to do whatever physical activity you were used to doing before being pregnant. So if you are a jogger normally, it's okay to jog. If you are a rider normally, it's okay to ride your bike. This isn't the time to start training for a marathon, but certainly safe to do anything that you were previously able to do, should be safe for you and baby. In terms of mask wearing, I really feel for you. I know it's very hard already. You feel like you can't breathe, and people have had a lot of difficulty with masks covering their faces and the sensation of not being able to breathe. From a medical perspective, you can breathe. I promise you, you can breathe right through that mask in and out. This concern about CO2 buildup underneath the mask, that's all over the media. We have not proven to be the case in a lot of different settings. And all of us wear masks for 10, 12 hours a day, and we're still standing. So it's possible, but I know it feels like it's not, and that can be really, really hard. I think cloth masks, while easier to access and more convenient, people tend to have a harder time with because you don't know what they're made out of or what the layers are there. And they're not as well tested. So whenever you're able to get a surgical mask, I think that can be helpful. And I've had a number of patients have success with using something called a mask bracket. You can actually Google it online, face mask brackets or face mask cups. It's essentially a small cup shaped device that you put over your face first underneath the mask. And all it does is actually keep the fabric from getting in your nose and mouth when you take a breath in. And just that sensation of not having fabric or cloth going in and out of your nose and mouth can help a lot for you to feel better when you're trying to walk around with a mask on. So that's something that is certainly safe to do and something you could try. Might help.
Great, thank you. So thank you so much to you all for this evening's conversation. I'm happy to see all the questions come in. And I think it's very important that we do all that we can during this time to protect ourselves during this time. So the takeaways definitely, at least from my end, are to wear your mask, wash your hands, soap and water, stay physically distant. I know that it's tempting. Thanksgiving is next week, but we have to make sure that we're taking care of each other and really abiding by those guidelines that are set forth by the state. I know that everyone stuck around just for the raffle, so I will announce our 3 winners this evening. I presume that you all have registered, but if you could do us a favor and just put your email address in the chat to panelists, so I have it, that would be great. So if your first name starts with P and your last name is Small, that's P Small, you are our first winner. The second winner starts with E as in Erica, last name Brown, E Brown. And lastly, we have first name starts with R, last name is Brayer, R Brayer. So those are our 3 winners, and we thank you so much. We thank everyone so much for joining us this evening and really engaging in these conversations. I want to personally thank Dr. Saleh, Dr. Parikh, and Dr. Sanso for your expertise, for taking your time out this evening to chat with us. And I also want to thank Art Tang, who's behind the scenes making this all happen. It couldn't have been done without you all, so thank you again. And just lastly, I'm just going to drop a quick link in the chat if you want to sign up for the rest of our events this week. So as mentioned, we'll have our event we'll have our 2 events in English tomorrow and Wednesday. We're also having events in Spanish. So I will drop those links in the chat and then we will end. So panelists, you can go ahead. I'll be right here just dropping the links. And thank you all again and have a wonderful evening. Stay healthy, stay safe. And did you guys want to say anything before we head out?
I wanted to
Thank
say
you so
thank
much.
you, Kelly, for a great job done. You did really a Herculean job putting all of this together. And thank you for the other panelists and to the, most importantly, to the people who attended, who asked the questions. This is such an important topic, and we're so happy to have been here. And thank you for having us.
Yes, thank you. And someone did ask, before I forget, someone did ask just about when you register, you may just have registered for one night or two, or not all 3 nights. So using that last link that I put in the chat, you can register for the 2 additional nights. And tomorrow we'll be talking about smoking cessation, asthma, COPD. We'll get into some lung cancer conversation on Wednesday. So please join us. And definitely we don't want lung cancer to necessarily be a scary thing for everyone. It's really important to educate yourself, to empower yourself with the knowledge, and that's what we really wanted to do with this talk this evening. So I'll stop talking. Thank you so much again. Have a great evening, everyone, and hope to see you in the coming evenings. All right, bye, everyone.